Hi everyone, and thank you for joining our webinar this evening on the transition from fertility to maternity. I'm Kate from Fertility Network, and we've got two wonderful guests this evening. We've got Francesca Steyn, who's the chair of the RCN's Fertility Nurses Forum, and Angela Cartwright, who's from the RCN's Midwifery Forum. We wanted to do this webinar because we know that the move from a fertility clinic to maternity services can be really difficult. And the Royal College of Nursing actually produced a report into this to look at how to support fertility patients better when they move into maternity care. So Angela and Francesca are going to talk a bit about that this evening. They're going to talk a bit about what's going on to try to improve care for fertility patients and also answer some of your questions about moving from fertility to maternity care and how to get the best from that. We are recording this webinar and it'll be available in the next few weeks or so on our YouTube channel, and you can access that either on our webinars page, but we'll also put it in our Facebook group, our pregnancy Facebook group, and on our Health Unlocked pregnancy forum. And we are producing a fact sheet as well to go alongside this, which we'll publicise with the webinar. If you want to ask questions, you're very welcome to do that. You can just pop them in the Q&A box. Don't put your hand up because you won't be able to ask questions that way. You need to actually type them into the Q&A box. And if you want to ask a question, don't worry about doing that. It will be completely anonymous. I won't be reading out anyone's name. Finally, one other thing just before we start. All of our services are free, but we're a small charity and we do rely on donations. So if you did feel able to make a small donation to help us to put on more webinars like this, we'd be really grateful. It's very easy to donate. You can do it just by texting, and you can text FNUK and the amount you want to donate to 70085 for a one-off donation. So if you wanted to donate £5, you could text FNUK5 to 70085 for a one-off donation of £5. And we're very grateful. Thank you in advance to anyone who does feel able to do that. We're really grateful for all of your support. But now we'll move on to the webinar and to the questions we've got for our two lovely guests this evening. The first thing I really wanted to ask Francesca was about why the RCN decided to produce this report in the first place.
That's a really good question, and thank you for inviting us to speak. But in answer to that, we've been really aware for a number of years of the gap that's there between the transition from fertility to maternity care services, and the fact that we needed to stand up as a profession really and say, like, we need to collaborate with our midwifery colleagues to be able to bridge that gap and do something about it. And I think it was also about, understanding that we are shared care. We should be promoting shared care and making sure that, once you've been through, the traumatic and difficult process of fertility, that you might need to, that's a bit more care and support when you are in your maternity care and the maternity service. So making sure that, those two services came together and looked at, how we could make that process a bit smoother. And just for the education, because as fertility nurses, it's quite rare for us to know what happens in the maternity units, because we're not all of us, there's many of us that have trained in midwifery, but not all of us, so we're not aware of what goes on there. And I think the same and vice versa with our midwife colleagues and fertility nurses. So bridging that gap, coming together and making sure that we are providing shared care and promoting best practice is why it all came about, really.
Angela, I wonder, do maternity staff get taught much about fertility as part of their training?
No, so I trained quite a while ago, although I am involved in training midwives now. Fertility care gets very much taught as part of the physiology of reproduction. It's almost a bit of an add-on. So you might find out, I learned a little bit about IVF, for example, but time moves on. And I think for many midwives, even if certain universities are teaching about fertility experiences and treatments, it's not something that we would get any update on. So people come into maternity care and might explain the journey that they've been through, but actually we as midwives may not recognise some of those acronyms, some medication that women have been on, or actually have an understanding of that journey.
Francesca, what do you think the main problems are for fertility patients when they move into maternity care? And what do you think it can be really difficult about it?
I think, understanding, and what Angela's just said there actually, is understanding the journey they've been on. We know that many fertility patients may have been through rounds and rounds of treatment before they actually get to the maternity services. So the emotional impact it's had on them, the physical impact as well, rounds and rounds of treatment and being prodded and poked and injections and things like that, you can be nervous. And, I think what we see in clinic, and we've seen it quite a lot, is that and historically patients get to a point where they're trying so hard to get pregnant, and they go through all of this, and then they get quite fearful of having to leave you and move on to a different service where they don't know the staff, and they're worried that the staff won't know their history. So I think that's what we see, and that's the feeling that we get. So there is a real fear and a real worry, and just the emotional aspect of then moving on, so going through all of what you've already been through. And we know that a lot of the time with fertility patients, they get to that point of, and they've actually got pregnant and they can't actually believe it's happened, and they haven't fought past that, and then it's like sheer panic, I don't know what to do next. So I think that's one of the things I think, and what we see in so just the emotions that really hit when you are going through that.
Angela, do you think many maternity staff have a real understanding of those kind of emotions, that extra anxiety that fertility patients can feel?
I think it can vary. So certainly I've got midwifery colleagues who have been through successful or unsuccessful fertility treatment themselves, and therefore they've got their own experiences to go on. I think it can be looked at one of two ways. I think some midwives can see this as, I've heard it described, a very precious pregnancy. Some people would say that every pregnancy is precious, and therefore will accept that women might be and obviously fathers as well, that there might be more anxiety, a more emotional discomfort, but at the same time an expectation that people should be really happy now they're pregnant. And as Francesca just mentioned, for some fertility patients, it's almost like, even though you've become pregnant, you might have had scans, you could feel your baby moving, people don't always actually accept, yes, I'm having a baby, because the risk of I've just not got here before, I really don't want to accept this is true because it's going to be too hard. On the flip side, I've heard other people saying, well, just because it was hard to get pregnant doesn't mean you can't be pregnant and have a baby. So to some other people it's like, well, actually it's the same as everybody else, now you're pregnant, we can treat you the same. So I think it's about that really individual relationship that women need to be able to have with their midwives, so that they can talk about some of those fears if they've got fears, and some of that excitement if they've got excitement, openly.
Angela, are there any actual formal links between fertility clinics and maternity services?
No, so I think it's a bit dependent across the UK, and I think some of that depends on whether we've got shared medics or potentially shared nurses or midwives between services. But in my experience, we don't have those links. So, fertility services, when they're like, yes, we've succeeded, we've done your job and got you pregnant, you're now off to the next service. But actually, there's no formal handover. So as midwives, when we do a booking during pregnancy, which is often taking, a history of that individual and the family, we're very much reliant on what people tell us about their journey. So there's no sort of formal handover, and therefore no educational training really about actually what happens. And obviously fertility treatment has changed and improved dramatically, and there's new innovations all the time, and I think it's quite hard to keep up with that if it's not your main focus of practice.
Francesca, I wonder if something that could happen is that clinics could do a bit more to prepare or support patients, perhaps, because we know that fertility patients often tell us that they feel a bit lost when they leave the clinic. I mean, is there more that they could do you think?
That is a really good point, actually, and I think and patients tell us that all the time, and we feel like that too, that is there more can we do? So we know that after 6 or 7 weeks, the gestational scan, then we just send them off with a letter for their GP, and it's sort of the end of the journey. I mean, realistically, there's not much we can do further than that point, and because we're not a midwifery service. So, you know, when patients do start to hit 10 to 12 weeks, and, you know, we don't have those skills to support them in that stage of the pregnancy when it goes beyond early pregnancy. So, but there could be, you know, potentially there could be some stuff that we can do in order to support them. And, you know, I think it does come down to just how busy fertility clinics are, and staffing levels and things like that, and capacity. But, you know, maybe just a little bit of a check-in, you know, providing some resource about this is what you should be doing and shouldn't be doing during early pregnancy. I mean, some clinics do that, I think, but not all of them. So making sure that we're, you know, giving as much resources as we can. But I think there's always still that, you know, time when, you know, they're not sure what to do, or they sort of feel lost and dropped into the abyss, if you like, because they leave the clinic at 6 weeks gestation and they don't actually get to see anyone next until like 12 weeks. So I think there is something to be looked at that we could potentially do in future. But, you know, in the interim, I think, you know, as much support as possible, and just having that open. And I think the other thing now is lots of clinics are having these like messaging services as well, so that it's not so difficult to get hold of the clinics, but just having that open, you know, open channel so that people can call in and find out, you know, is this normal? I've got a headache. Is that all right? Because these are the real worries, aren't they? You know, and they're just not sure where to go, where to turn to. But I do think there's work to be done in, you know, supporting what, in an ideal world, I think what should be happening is that we should be able to support until 12 weeks and then hand straight over to our midwifery colleagues and give a proper handover, like you would in any other healthcare facility, really. When you hand over something like that, that would be ideal, I think.
That sounds a really excellent solution, I have to say, because one thing, Angela, that comes up a lot that patients ask us is that they just don't really know quite who they're meant to contact when they're worried about something in early pregnancy. I mean, should they have been given one point of contact once they get pregnant?
So the time that most people are given that contact is during their midwifery booking. The aim is that midwives should be able to undertake that initial assessment and information sharing exercise with women before 10 weeks gestation. But in reality, because of workforce pressures, as Francesca said, it's often more getting to sort of 12 weeks before women are seen. Even if you are given a contact at that point, maternity services in terms of urgent care tend not to take pregnancy until around 16 weeks. So before 16 weeks, anything that is urgent, such as abdominal pain or unexpected bleeding, will tend to go through early pregnancy assessment units. And again, they're a wonderful resource that work very, very hard with early pregnancy complications, but they are an acute service and they're often not able for women to contact them directly. They're often via GP or A&E. Later in pregnancy, then, you know, midwifery takes over for both that, you know, advice and information about normal signs and symptoms of pregnancy, but also anything acute. And I think what we're missing in early pregnancy is that information and reassurance. You know, so as you say, somebody's got a headache, they're not necessarily going to get referred into an early pregnancy assessment service because it's not appropriate. And yet for that individual, that could be a really worrying time where they may have loads of questions and you know, lots of concerns, but there isn't necessarily a service there to meet their need. But yeah, certainly from when women are booked with a midwife, they should have a contact number that's available 24 hours a day for any urgent maternity issues.
The other thing that we hear quite a lot from people is they're really used to having quite a lot of scans at the clinic. And one thing that can be very tempting is, you know, you've had your scan when you leave the fertility clinic. We often see people wanting to pay for additional reassurance scans in those kind of gaps in between maternity care. I mean, what would your advice be about that, Angela?
Yeah, and it's something that's really only sort of come about in the last 10 or 15 years, that you know, what we sometimes call recreational scans, reassurance scans, and that could be, you know, to determine the fetal sex or just to get photographs or videos. And I can see as an expectant parent, it's really, you know, tempting, particularly if you've got a lot of anxieties and you feel, you know, that seeing that baby is going to give you reassurance. The difficulty with this is that ultrasound scanning is a medical intervention. We offer scans during pregnancy for a couple of reasons. So that's to determine, you know, how far along the pregnancy is, if there's one baby or more, particularly for people that might have had fertility treatment that could result in a multiple pregnancy, but also to detect if there's any concerns with the pregnancy, both in terms of the baby or growth throughout the pregnancy. Many of the privately available bonding scans as such don't have that clinical governance. So if they spot that there is an issue, there's not clear pathways. And although we know that scanning is safe when used for medical reasons, we don't really have the evidence that scans, which can go on for quite some time, for example, to get videos or to tell fetal sex, that they are safe. So, you know, the advice would be, if people have got concerns, you know, speak to the midwife, and really to stick to the medically indicated scans if at all possible.
That's really useful advice, thank you. The other thing I wanted to ask you, Francesca, was about people who've used donor eggs or sperm, or those from the LGBT community, who've sometimes reported a bit of a lack of understanding from maternity staff. And I know this comes up in your report. I mean, do you think there are particular areas that need more attention?
Yeah, I think so. I don't think it's due to people not wanting to support people from the community with their pregnancies and beyond. I think it's about the education. So for surrogacy, for example, so I was involved in a couple of years ago in producing the Department of Health guidance on surrogate care of surrogates and birth. But that was a real highlight to show that, there was a lot of people in maternity services and antenatal units that weren't aware that surrogacy was legal, and we can proceed with surrogacy cycles in this country. So, so when gay men present to antenatal services with their surrogate, they're often being sent away and things like that. So I think there is more that we can do about raising awareness there and supporting the community. But, as Angela said, it's when you see your patient and when they're booking, you're getting the information from them directly. There's no official handover. So if there was a way that we could say, hi Angela, just to let you know, this is a surrogate pregnancy. These are, so and so are the intended fathers. This is how we use donor eggs to create embryos and transfer. So that sort of information is clinical information and could be shared at a professional level to save a lot of anxiety for people from the community. I think when they've already been through an awful lot to get to the point they're at to achieve a pregnancy, and then they have to go in and explain the whole situation again into other services. So I think it comes down to being able to provide a good handover, I think. But we do see that there is there are a lot of people from the community that do have experience difficulties when they do enter into maternity services, and maybe there is a little bit of a lack of understanding of how the pregnancy came about and supporting from that point.
Do you think, Angela, there will be a welcome for kind of more education about that from maternity staff?
Yeah, I certainly think that is the case. And what we tend to see is, at an individual basis, I think people want to do the right thing. People want to refer to people using maternity services by the correct pronoun, and also, by the right title. So, for example, if you're a surrogate, you potentially don't want to be called mum. And equally, if you're having a child via a surrogate, you maybe are the mum or dads, for example. I think what can happen in media and that sort of mainstream, but also social media, is sometimes moves to be really open about maternity services. So, referring maybe to pregnant people rather than pregnant women, referring to people giving birth, or referring to chest feeding as well as breastfeeding, is sometimes ridiculed and seen that actually we're taking maternity care away from women and from mothers, as opposed to recognising that actually we need to use the right terminology for the right people. So yeah, I think being able to have that discussion openly as midwives, and discuss the sorts of families that we may see coming through services and how we can support them would be really important.
Thanks. Francesca, one thing I wanted to ask you was, I don't think fertility patients always shout very loudly about their needs, partly because it's such a kind of emotional and such a sensitive and private subject. Do you think we should be doing more to kind of empower people as they move through this journey to kind of feel that they can speak out more and ask for what they want and what they need?
I think so, and you're right. So I know that lots of fertility patients, we still see that fertility is very much a taboo subject, and people don't want to, share that they've been through maybe an IVF journey. There's also still a lot of shame and stigma and guilt surrounding going through fertility treatment. But I think there is more we can do to empower people. People shouldn't feel that way. And it's interesting because I think there's also a lot of education that can be done from the wider community, really, to say, actually IVF is normal. 1 in 6 couples will experience fertility problems. It's a normal way of conception. And I think, so supporting people that are going through the journey as much as we can, and empowering them to say, look, yeah, this is a pregnancy, it's an IVF pregnancy, rather than hiding away and saying, actually, I'm ashamed to say it's an IVF pregnancy. It's very much, we're in 2022 now, where there are a lot of babies born in the world through IVF and fertility treatment, and letting people know it's okay to talk about that and share what they've been through, what their experiences are, so that they get the right care.
That's really helpful, thanks. Angela, I wanted to ask you, would you have any recommendations for people, for former fertility patients moving into maternity services, as to how to get the best out of maternity services?
So I think a really key thing is, if people feel able to be open with the midwives about what their journey has been, about any pregnancy losses, about any medication that they're taking. And I think also to remind people about this as well, because, we're moving now towards electronic patient records. It doesn't always come up. So sometimes it does feel like you're having to tell people. I think something that really came out in the work we did for this document was that often people had sort of said, look, I'm very, very anxious, but maybe midwives had sort of discounted that as being normal anxiety for expectant parents. And I think it maybe is, and it's hard to ask patients themselves to do this, because it should be up to us as professionals, but to say, actually, I've been through a really tough journey to get here. This isn't just normal anxiety of an expectant mum, and therefore, I suppose you're having to ask to be referred to the right services, because otherwise busy midwives can sometimes just think, yeah, all expectant mums tend to be a bit anxious, and maybe not recognise just the extent of that anxiety. So again, it goes back to what you were saying to Francesca, really, about encouraging people to be assertive, to make their voices heard and make their needs known.
I think that's a really important point, actually, because one of the things that we've often heard from people, coming through our pregnancy groups, is that, they've said they feel anxious, and they felt that was just, oh, right, okay, we'll tick anxious box, but nothing followed on from that. So I think it is a really important point that you've just made. We do have a few questions that we've got. I've just realised that the Q&A isn't on here, so you have to put questions, if you've got any, into the chat. If you don't want anyone else to see your questions, you can just address them to the host and panelist, and then no one else will be able to see them apart from us. But we do have a few questions that came in just before the webinar. One person's asking about whether there are any plans to standardise the language on a 12-week screen form. Apparently it currently says extraction date rather than a collection date, as it's referred to throughout IVF treatment. Have you come across that, Angela, it being called the extraction date, and are there any plans to change that?
It's not something I've come across. I feel like that's more of a Francesca area. I'll go to you, Francesca.
So that is not a word I've heard for many years in fertility, actually. So, I mean, there's a number of acronyms which Angela's already said about, but normally it's vaginal egg collection. So, yeah, I don't know if extractions is the right word. It might just be, a local trust or a particular trust. So I would take that potentially back to the trust and ask about changing the language, because that isn't the right term. We're not extracting anything.
If someone wanted to do that, Angela, if someone wanted to raise something like that, what would be the right way to do that if you want to challenge something that you think isn't quite right or isn't quite understood?
So every area has their own maternity voices network, It used to be called, I'm just trying to remember, maternity partnerships. They're called maternity voices. They're really to get the needs and the experiences and the voices of people who use maternity services heard. And so if people essentially just, you know, search on the internet for their local area and their local maternity voices, they should be able to get an email for both the chair and the administrative support. Some of these meet in person, some of them meet via Teams. Sometimes you can just feed information in via email or phone call to them, but that should get that question back to whichever trust is involved.
Thanks, that's really useful advice. I think maternity voices can often be really quite powerful, can't they? So it's a really useful place to take concerns. We've got another question about whether there are any plans to advise midwives on how to sympathetically ask whether a donor egg's been used, especially in connection with when they fill in the 12-week NHS screen test form. I mean, is that something that comes up about donor eggs at all?
That's a really good question. So I think it does come up, and I do wonder if the people who are, you know, whether it's a midwife or somebody else who's filling in that form, makes an assumption about it. So, you know, if somebody is a little bit older, if somebody has written, you know, it's on notes that somebody maybe has had fertility treatment, that therefore they're asked. But if people haven't disclosed that information, they're not asked. I suppose it's the same as if, you know, there's lots of things we need to ask people about. We need to ask it in a way that leaves us open for whatever the answer is and accepting of whatever the answer is. And sometimes I think we can do it in a bit more of a prejudged way. So yeah, I agree. I think, you know, any conversations, we need to make sure that we're open to whatever the answer might be.
Great, thanks. We've got one more question that's come in. Do please feel free to ask if you have any additional things you want to ask. Someone's asked whether there are any plans to give midwives knowledge of the whole of the IVF process. This person said their midwife couldn't understand that they had an embryo transfer 5 days after egg collection, and even checked that they didn't mean the egg collection was the year before. I mean, is there often confusion about what actually happens during an IVF cycle? And would it be helpful, do you think, for midwives to know more about that?
Yeah, I've learned so much from working on this guideline with Francesca and other colleagues, because I had some idea of how fertility treatment works, because as I say, I've had colleagues and friends that have gone through this. But I think it's very easy to make assumptions about, you know, whether somebody is using, you know, frozen eggs or frozen embryos. And again, whether it's, you know, we've got donor gametes or not as well, you can make assumptions. So I think it would be useful for midwives to understand, you know, how some of these processes work, because as I say, it's not the end of maternity that we tend to be coming from. People already come to us pregnant, and there might be an opportunity for, you know, some sort of journal article in one of the midwifery journals that are quite easy to read, that explains what some of these processes are and how midwives can support, you know, people expecting a pregnancy following fertility treatment. That could be useful.
We've got another question here about whether there's potential training, you think, in the future for midwives to support couples going through fertility treatment. I mean, do you think it is possible that at some point we will see a change in the training, and that fertility, I mean, as fertility treatment becomes more common, you must be seeing far more former fertility patients than you would have done in the past. And it seems that it is almost really something that any midwife should be aware of. I mean, do you think that is something that we might see happening in the future?
Yeah, I think we could. So the standards of training for midwives were revised fairly recently, but it is something the Nurse and Midwifery Council review every few years. It's actually are the standards of proficiency for midwives and nurses as well, compatible with what the modern world is needing from nurses and midwives. So it certainly is something that could be suggested as a topic. We have also put a webinar on where midwives, fertility nurses, early pregnancy support workers, and many others were invited to. So we have done a webinar regarding this training. But it is, you know, as you say, it is an opportunity maybe that we could think about.
Yeah, this person's just expanded on it, saying that during their recent pregnancy, they had different midwives at appointments and had to keep explaining the situation over and over again. And would it be possible that fertility patients might be able to have the same midwife throughout? I mean, is that the kind of change that you'd like to see?
So part of the national attempt, so from Better Births, which was 2015, right the way through to sort of modern today's NHS, which have got something called Core 20+5, midwifery continuity of care is still there. And that's for that very reason, that regardless of whether you've had fertility treatment, whether you've got underlying health conditions, actually having to keep on telling your story time and time again, it means that things can potentially get missed. It makes the midwife's job more difficult, but it also makes it really difficult for that pregnant person. And we know that having, being able to build a trusted relationship with somebody, it takes 3 or 4 meetings and conversations until people actually trust you. And if we want people to be able to trust us, for them to say how they're feeling, maybe they've got issues in a relationship, maybe they've got issues in money, whatever their concerns are, we need to have that continuity. So it certainly is part of the NHS plan for people to have continuity of midwifery care. The pressure on that is workforce pressure at the moment, and it's something that all maternity trusts are looking at. Some are doing very, very well with continuity, and some are not quite so far down that path.
Francesca, I think one thing that could happen that wouldn't cost any money or take any time is that fertility clinics could maybe tell patients more often about the kind of support that they can get through Fertility Network with the peer support groups, which I think is incredibly helpful because it can kind of normalise some of those anxiety feelings and help people know that it's not just them, that this is, quite a common way to feel. I wonder, I mean, do you think there is more that clinics could do on that front?
Yeah, I definitely do. I mean, the HFEA, we know that one of their aims, one of their, the most important aim, I think, is the emotional support for patients going through fertility treatment, and it's mandatory to provide or to offer counselling with a specialist fertility counsellor. But there is much more we can do, and some clinics, that's just what they do, but there is so much more we can do. And even if it's a leaflet with the details of FNUK or posted around the waiting room and things like that. And I think there's something that we could all do better, is almost like when Angela and her team do a booking in, we could do a booking out meeting, really, where I know that sometimes we do have a chat with the patient before that, once they've had their scan they go, but maybe we could expand on that actually, and do include all of this information there and say, look, you're not alone, you have all of this resource, particularly from FNUK, this is a whole list of things that you should and shouldn't do in early pregnancy, that sort of thing. So making it a bit more of a supportive consultation, providing everything that we possibly can to provide that support, but definitely signposting. There is a lot more that clinics can do to signpost to FNUK and to support, I think, the charity a bit more. I mean, I know that lots of clinics do support the charity, but there's so much more we can do to raise awareness and support the charity, so that you also have that resource to support all of these patients that we're going to potentially refer to you.
What about also counselling? I mean, I think some fertility counsellors are very happy to carry on seeing people in early pregnancy and can really offer a lot of support, can't they? But do patients always know that?
I don't think so. And I think the other thing that we do have to be aware of is that some clinics still do charge for counselling. You have a set amount of counselling appointments, and they might charge. But I think, again, with that, making sure that patients know that they've got access to their counsellor, because as we've said, they might be, it's an emotional journey, but they might be doing okay in the treatment, but when they're pregnant and it hits them, the reality of being pregnant finally, after all of that turmoil they've been through, that they really potentially sometimes do need the support there. So knowing that they can reach out to the counsellors at that point is, I think we need to do more to make sure that that's clear to everyone.
Got another interesting question here about whether there are any plans to train sonographers in antenatal clinics too. We've talked a lot about midwives, but we haven't talked much about that. This person said, I found some aren't really empathetic to a patient that's already been through IVF treatment, or understanding that in earlier scans, ovaries might be enlarged and hurt when scanning. I mean, what do you think about that? Is there room for more training there too?
Yes. There's a
Yeah.
short answer there.
And I think you've made a really good point there, the person that asked that question, that it's not just midwives that are involved in maternity care. Obviously, we've got ultrasonographers, we've got obstetricians that may need to be involved. Many maternity units also have a range of, whether you've got maternity support workers, whether you've got healthy pregnancy support workers. There could be a whole range of people that may be involved with somebody during pregnancy, and therefore there is something about actually potentially expanding this work so that people have got a little bit of a feel of what it might be like for somebody embarking on a pregnancy following fertility treatment.
I think we've gone through most of the questions we've got now, but I just wanted to finish whether both of you would have a sort of tip that you'd give patients going through. I mean, Francesca, what if we came to you first? Is there anything you'd say to someone who found themselves pregnant? What would your advice be?
I'd say, be vocal. It's not, you shouldn't be ashamed or feel guilt about you've been through a fertility journey. It's very common. You may feel that you're in isolation, but chances are someone in the midwifery antenatal unit next to you may have been through the same thing. So be vocal about it. Speak to your care team, all of them, and let them know that you do feel a little bit anxious. You've been through this one hell of a journey, and you might need a bit more support. But yeah, I would say reach out and take every inch of help that you're offered, so that you get the right care for you.
Angela?
Yeah, and I'm really just echoing what Francesca said. I think it is about, sadly, people do need to advocate for themselves. Every midwife goes to work wanting to do the absolute best for the people in their care. But when we're all very, very busy, sometimes, it is the person that shouts the loudest. And so, it is insisting, if you are worried, just keep going back. Don't think that you're being a nuisance. Don't think that you waste anybody's time. Every midwife will want to help to either reassure or get some more care in place for somebody that needs it. So yeah, definitely shout up if you've got needs.
I think that's a really useful concluding piece of advice. Don't ever think that you're being a nuisance. But Angela and Francesca, thank you so much for joining us this evening, and thank you for all the brilliant work you've done with the RCN on this, because I think it's such an important area and it's really great to see it finally being covered. And thank you to everyone else for joining us as well. Just a reminder that we do have our pregnancy group that's a closed Facebook group, and the group also meets every month. They have a meeting online, so you can join from wherever you are. And we also have a Health Unlocked pregnancy forum as well, where you can talk to other people at any time. So do please use our resources. You can also call our support line when you're pregnant. We've got 2 former fertility nurses running that, and they're always happy to talk to you when you're pregnant as well as when you're trying to conceive. So do please use our services. But thank you for joining us, and thank you so much to Angela and Francesca for being with us this evening. It's been really helpful and really interesting. So thank you very much.
Thank you.